Hello and welcome to CML Exploration's 2020 and 2021 Open Enrollment Benefits Presentation recording. My name is Jennifer and I am with Gallagher Benefit Services, your insurance broker and consultant. Our company's contact information can be found on page 2 of your benefit guide. This year, the open enrollment period will be from July 7th to July 13th. Any changes made during this time will be effective August 1st and will stick with you for the entire plan year unless you experience a qualifying life event. Open enrollment is the one time of the year you are able to make changes to your insurance benefits without having proof of insurability. Enrollment changes this year applies to medical, dental, vision, and voluntary life. A qualifying life event may be obvious things such as marriage or divorce, birth, adoption of a child, or other events which result in losing or gaining other healthcare coverage. If you experience one of these events, you must notify HR within 30 days of the event in order to make changes to your plan elections. Changes to your plan elections must be consistent with the life change. There's one exception to the 30-day notification rule. If you, your spouse, or dependent child loses or gains coverage through Medicaid or a state children's health insurance program or CHIP, you have 60 days to notify HR. Before we jump into the details of each plan, let's look at an overview of the changes for the 2020 plan year. You will notice that there are only a few changes to the benefit plans. One of the most important strategic goals for CML is to continue to offer a desirable benefit package with affordable rates for its employees. This year, we have decided to move back to a traditional medical plan that has a lower deductible and copays. Blue Cross Blue Shield will continue to administer the medical plan. Your dental carrier is changing to Blue Cross Blue Shield, and you will see a slight increase in the cost. Dearborn National is now Blue Cross Blue Shield, and they will continue to administer your vision, life, and disability benefits. Let's take a look at the medical plan that CML has to offer. As I previously mentioned, we have moved back to a traditional plan that offers a lower deductible and best of all copays for office visits and prescriptions. Your medical plan is a PPO plan that has both in-network and out-of-network coverage. We will focus on the in-network benefits. Your major medical services such as hospital stays, inpatient or outpatient surgeries, maternity claims, and all major radiological services like MRIs and CAT scans will apply toward your calendar year deductible of $3,000 for an individual with a $9,000 deductible per family. If you meet your deductible, Blue Cross Blue Shield will begin paying 100% of the remaining charges with the exception of copays. Your worst case scenario that you will pay out of pocket is known as your annual out-of-pocket maximum. Once you hit your out-of-pocket maximum of $3,500 for individual and $10,500 for family, you will have 100% coverage for all covered medical services, including all medical copays and all prescription copays for the duration of that calendar year. Your preventative services and your outpatient diagnostic lab and x-ray will still be covered at 100% without having to meet your deductible. Examples of preventative visits are annual physicals, annual well woman visits, annual well child checkups, and depending on your age, mammograms and colonoscopies. Keep in mind there's a difference between preventative and diagnostic. For example, if your physician is recommending a follow-up mammogram for further investigation, the follow-up test would be considered diagnostic and subject to deductible and coinsurance. A visit to your primary care provider or obtaining a virtual visit will be a $35 copay, and a specialist visit will be a $70 copay. Urgent care visits on this plan are a $75 copay with an ER copay of $500. Urgent care facilities are a viable option for minor emergencies such as earaches, pink eye, flu-like symptoms, minor lacerations, and strained muscles. I always recommend visiting an urgent care facility for minor injuries or illnesses as they are less expensive and you can typically be treated faster than in an emergency room. Be aware there are several standalone ERs which can easily be confused for urgent care facilities. You can always find a list of facilities specifically designated as urgent cares from the Blue Cross Blue Shield website or mobile app. Blue Cross Blue Shield lists drugs in 5 categories: preferred generic, non-preferred generic, preferred brand, non-preferred brand, and specialty. If and when possible, it is typically more cost-effective to use generic medications. If you are obtaining a new prescription, it's important to ask if a generic is available from either your physician or your pharmacist. A lower copay is applied when you are using a preferred pharmacy. For convenience, Blue Cross Blue Shield has a mail order prescription benefit to encourage members taking routine medications such as birth control or high blood pressure medications to request the medication be mailed to their home address. The mail order benefit is a 3-month supply. You will notice out-of-network coverage listed to the right, but it is very important to remember always seek treatment from an in-network physician as out-of-network benefits will cost you significantly more out of pocket. Any portion of your calendar year deductible that has already been met will be carried over to the new plan. Some of Blue Cross Blue Shield's extras include Blue Access, the online member portal, and its mobile app. Through these portals, you can access your explanation of benefits and order ID cards and search for in-network providers. The Treatment Cost Estimator is an innovative cost transparency tool to help you make more informed healthcare decisions. In a matter of minutes, you can get an estimate of your procedure or treatment cost. Use the Treatment Cost Estimator to search for providers, estimate the cost of treatments, procedures, tests, and other healthcare services. The least expensive and time-consuming avenue to receive care is through a virtual visit. Blue Cross Blue Shield provides you and your covered dependents access to care for non-emergency medical issues and behavioral health needs through MD Live. GoodRx is a free resource that can help you save money every month by finding the lowest prescription price at a local pharmacy. Blue Cross Blue Shield has registered nurses waiting to talk to you whenever you call the 24/7 nurse line. These nurses can help answer questions and try to help you decide whether you should go to the emergency room or urgent care or make an appointment with your doctor. The Blue Cross Blue Shield mobile app puts your health at your fingertips. With the mobile app, you can use the provider finder tools to search for a healthcare provider, hospital, or pharmacy, request or print your ID card, check the status or history of a claim, and view your explanation of benefit statements. Also, you and all your covered dependents age 18 and up can download the mobile app and create an account. You can maximize your medical benefits by getting preventative screenings every year. They're free and can catch conditions before they become severe. Always go to an in-network provider when available. Register and use the resources available through the Blue Cross Blue Shield website and mobile app. Use GoodRx as a resource to find the lowest cost prescription for you. Use the emergency room for true emergencies only. While CML is no longer participating in a high-deductible health plan and contributing to the health savings account, the funds in your health savings account are yours to keep. So what can you do with those unused funds? You can use those funds to pay for medical expenses such as deductibles, office visit and prescription drug copays. pay for dental and vision expenses. You can use the funds to pay for your dependents' eligible expenses, even if they are not covered on the plan. Reminder, beginning on August 1st, you will no longer be able to make contributions to your health savings account. Also, anyone who has funds in their account will have a $2.25 monthly service fee deducted from their account each month. Let's take a look at these two great benefits. Your dental plan is moving to Blue Cross Blue Shield and will use the Blue Care Dental Network. It is a PPO plan that offers in and out of network benefits. Blue Cross Blue Shield's dental plan offers 2 preventative exams and cleanings per year. Basic services are covered at 80% after a $50 deductible, and major services are covered at 50% after the deductible. This plan offers a $2,000 annual maximum for benefits. This is the most the plan will pay out per calendar year for your covered dental expenses. Orthodontia is covered at 50% up to a lifetime maximum of $2,000. This benefit is covered for children through age 19. The percentage of benefits paid are the same whether you obtain services from an in-network provider or out-of-network provider. However, if your provider is out-of-network, they may balance bill you for the difference if your dentist charges above the reasonable and customary charges. It is advisable if you are receiving basic or major services to request your provider to process a predetermination of benefits, which means they will run a mock claim through Blue Cross Blue Shield to determine the amount Blue Cross Blue Shield will pay and the amount you may be responsible for paying. The vision plan is offered through Blue Cross Blue Shield and uses the iMed network. If you are using an in-network vision care provider, you have a $10 copay for an eye exam. You may have an eye exam done once every 12 months. If you wear glasses, you have a $10 copay for your lenses. You may get lenses for your glasses once every 12 months and frames for your glasses once every 12 months. For frames, you have a $130 allowance to spend, plus you get a 20% discount on any balance over the $130 allowed amount. If you are a contact lens wearer, you can purchase contacts once every 12 months. You have a $130 allowance for your contacts. If you use an out-of-network vision provider, you will be required to pay the full cost of the visit up front and will need to submit a receipt and claim form to Blue Cross Blue Shield to be reimbursed at the levels shown on this slide. Now let's take a look at your life and disability plans. CML pays for each benefit eligible employee to have a $50,000 life insurance plan with a matching accidental death and dismemberment benefit. This benefit is 100% employer paid. Remember to keep your beneficiary information up to date. If you wish to have additional life insurance, you have the option to purchase additional coverage on yourself and your dependents. You may purchase coverage on yourself in increments of $10,000 up to the lesser of 5 times your salary or $500,000. If you elect additional coverage on yourself, you may then also purchase coverage on your spouse in $5,000 increments up to the lesser of $500,000 or 100% of what you elected on yourself, and you may purchase up to $10,000 on your child or children. During the annual open enrollment period, employees and their spouses who are currently enrolled are eligible to increase coverage by $10,000 up to the guaranteed issue amount without submitting a statement of health. Employees and their spouses who currently do not have coverage are eligible to purchase but must submit a statement of health. CML also pays for you to have both short and long-term disability. Disability income is insurance on your income in the event you are unable to work due to an accident or illness of some sort. Your short-term disability benefit kicks in on the 15th day you are unable to work due to an illness or accident. The benefit payable to you is 60% of your weekly salary up to a maximum of $1,250 per week. It will pay this benefit up to 11 weeks. The actual benefit duration will be dependent upon your specific illness or injury. If you are still truly disabled under the terms of the policy after the 11 weeks is up, the claim will roll over into a long-term disability claim. At this point, long-term disability will begin paying 60% of your monthly income up to $8,000 per month. The maximum duration of payment is up to your Social Security normal retirement age, but again, the actual duration will be dependent upon the actual conditions of your claim. Your Employee Assistance Program provides you and anyone that resides in your household access to a variety of great resources for personal and work life issues. This benefit includes many great resources online, but also can provide up to 3 free face-to-face visits with a licensed counselor or therapist if you need that sort of assistance as well. The contact information to access this benefit is located in the benefit booklet. Now that we have gotten through the benefits, there are a few quick reminders. Payroll deductions can be found in your benefit guide. All employees must complete an enrollment form, even if you are declining coverage or not making any changes to your benefits. Please confirm your dependent information is up to date. Be sure to update your beneficiary information if you need to make a change. You will receive new medical and dental cards in the mail. Remember, you can use your remaining HSA funds to pay for office visit copays and prescriptions on your new plan. Open enrollment will end on July 13th at 5 p.m. If you have any questions as you go through the process, please contact Bob in Human Resources. Thank you again for your time and attention. Have a great day.